Rand ID 49A9. High blood pressure or hypertension is a silent threat that becomes increasingly prevalent as we age. After 60, the risk of developing hypertension significantly increases, and with it comes a heightened vulnerability to a cascade of serious health issues. We're talking about cardiovascular disease, the leading cause of death worldwide, where high blood pressure puts immense strain on your heart and blood vessels. Then there's stroke, a devastating condition that can rob you of mobility and cognitive function. And let's not forget kidney problems, as hypertension can damage the delicate blood vessels in your kidneys, leading to chronic kidney disease. But there's good news. Managing your blood pressure doesn't always mean relying solely on medication. Natural methods, incorporating lifestyle changes and dietary adjustments, can be remarkably effective in lowering blood pressure, and in some cases, these natural approaches can work alongside medication to enhance their effects, and sometimes, under the guidance of your doctor, they may even be used in place of medication. However, it's absolutely crucial to emphasize that you should always consult your doctor before making any significant changes to your treatment plan. This ensures that your approach is safe, appropriate, and tailored to your individual needs and health conditions. Rand ID F8. Now, before we delve into the natural strategies for lowering blood pressure, it's essential to understand what those blood pressure numbers actually mean. When you get your blood pressure checked, you'll see two numbers, one on top of the other, like a fraction. The top number is the systolic pressure, which represents the pressure in your arteries when your heart beats. The bottom number is the diastolic pressure, which measures the pressure in your arteries when your heart is at rest. Between beats. So, what's considered healthy and what's considered hypertension? Generally, a blood pressure reading below 120/80 mmHg is considered normal. Hypertension is typically diagnosed when your blood pressure consistently reads at or above 130/80 mmHg. This is often further categorized into Stage 1 hypertension, 130, 139/80, 89 mmHg, and Stage 2 hypertension, 140/90 mmHg or higher. For seniors, the target blood pressure is generally below 130/80 mmHg. However, it's incredibly important to remember that these are just general guidelines. Your ideal blood pressure target should be personalized based on your overall health, age, other medical conditions, and medication usage. Always discuss your specific target blood pressure with your doctor. Rand ID 1D91. Alright, now that we understand the numbers, let's talk about how to take action. Dietary changes are often the very foundation of naturally lowering blood pressure. And when it comes to diet, the DASH diet, dietary approaches to stop hypertension, is a fantastic place to start. It's not a fad diet, but rather a long-term eating plan that's scientifically proven to help lower blood pressure. The DASH diet emphasizes filling your plate with an abundance of fruits and vegetables. Think vibrant salads, colorful stir-fries, and juicy berries. These foods are packed with vitamins, minerals, and fiber, all essential for healthy blood pressure. Next up, whole grains. Opt for whole wheat bread, brown rice, and oatmeal over refined grains like white bread and white rice. Whole grains provide sustained energy and are rich in fiber, contributing to better cardiovascular health. Finally, include low-fat or fat-free dairy products in your diet. Milk, yogurt, and cheese provide calcium and other essential nutrients without the added saturated fat that can raise blood pressure. By focusing on these key food groups, you'll be well on your way to a healthier heart and lower blood pressure. We will be talking about specifics next. Rand ID 45A7. Now let's zoom in on a critical component of dietary change: sodium reduction. High sodium intake is a major culprit in raising blood pressure. Sodium causes your body to retain fluid, which increases the volume of blood and puts extra strain on your heart and blood vessels. So, how can you effectively reduce sodium in your diet? The first step is to become a label detective. Start diligently reading nutrition labels on packaged foods. Pay close attention to the sodium content per serving and be mindful of serving sizes. You might be surprised at how much sodium is lurking in seemingly innocent foods. Next, make a conscious effort to avoid processed foods. These are often loaded with sodium as a preservative and flavor enhancer. Think about it. Canned soups, processed meats like bacon and sausage, frozen dinners, and even some breads can be surprisingly high in sodium. Finally, get creative with your seasoning.